Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is August 4. The Delta variant is quickly gripping Wisconsin, especially among the unvaccinated. COVID-19 cases and hospitalizations are up, and so much information is rapidly coming out. So to help us understand the latest facts is Dr. Nasya Safdar, a professor of infectious disease at UW-Madison School of Medicine and Public Health. And Dr. Safdar, thank you so much for being here.
Thank you.
I want to start with understanding the difference between new case numbers that we're seeing in data versus the reality of how many people are catching this really contagious virus. Is Delta more prevalent than we know?
I think that's almost certain to be the case. You know, people can carry the virus in their nose and not have any symptoms. And so the only way to detect that would be if they got tested. But we know that Delta is far more contagious and easily transmissible than the other variants that have come before it. So it's not a stretch to say that that explains our recent case counts and numbers that we're seeing here.
Do we have any understanding of what that difference looks like, how prevalent it is, and is the sharp increase in hospitalizations the true indicator of how this variant is taking hold?
Well, I think the different metrics tell us slightly different things. So, for instance, we need to know how many cases there are so we can get a better sense of what is the magnitude of the problem and how widespread it is. And whatever numbers we have, they're likely to be an underestimate of the true state of events because not everybody is getting tested. But it is safe to say that of the vast majority of cases that we're seeing here, it's the Delta variant that is responsible for them. And so, you know, once a variant spreads like that, it quickly replaces whatever else might have been circulating before it. And so at the moment, it's really all Delta for all intents and purposes. I think the hospitalization piece is important because it tells us, besides being more easily able to transmit, is this also leading then to more people getting sick enough that they need medical care and hospitalization? And so far, what we're seeing is that, yes, people are getting hospitalized, but the majority of them are not vaccinated. And so that additional layer of protection that they would otherwise have isn't there. And that results in them getting more sick than they would otherwise.
Now, yesterday, the Legislative Rules Committee voted that UW campuses will have to have any requirements of vaccination, testing, or mask wearing be approved by this Republican majority committee. What is your reaction to that?
You know, so my feeling on this is that we have a suite of public health solutions that we know do work for containment. And for a while there, we could relax them a little bit because Delta wasn't around as much and we didn't face the same sort of evolution and state of pandemic that we're facing now. But now what we're facing I think, is going to need an all hands on deck approach. And so testing and vaccination and masking are all very important parts of that suite of solutions. So whatever way we can get them easily deployed, it seems like the right thing to do.
Also yesterday, President Biden announced a vaccine requirement for federal employees. Many other places have announced a vaccine requirement like this or be subject to regular testing. Should large institutions like the UW system require a COVID-19 vaccine for staff and students as we're looking towards the fall semester?
I think it's really important for everyone who's eligible for the vaccine to get it. Now, some people will choose to get it on their own, and whether a requirement is necessary or not may be a moot point. But the end goal is, I think, that everyone who is eligible should be given the opportunity and should really want to take the vaccine and take the vaccine. This is a highly effective intervention, really the major effective intervention that we have to halt the course of this pandemic's transmission. So, you know, any and all measures that will allow people to get the vaccine are likely to be useful.
The CDC is now saying that those who are vaccinated can spread the virus just as easily as the unvaccinated. New guidance is saying that everyone should be masking indoors. I personally haven't really seen many people masking. Should everyone be masking, and in what circumstances?
You know, I think this is a case of where there has been a clear shift in our thinking because of this variant compared to what we had seen before. And so it'll take a while for us to catch up to what we now need to do to prevent the transmission of Delta. I think the vaccines are doing exactly what we know the vaccines are capable of doing, which is preventing severe hospitalizations, severe symptoms, and complications. What the vaccines cannot do completely is to prevent transmission if people don't have symptoms. And so that's where masking comes in really handy. And I know for a while there, we were off the mindset that we don't need to mask anymore. And had it not been for Delta, I think that still would have been true. But this particular variant has an advantage over us in the sense that it can be shed by people who are vaccinated. And so masking needs to come back.
Are children who can't yet get vaccinated at risk? Is there a way that we can protect them? And is there a concern that when all children go back to school at the end of this month, it's really going to be a mixed bag?
You know, I think with respiratory virus season around the corner, we're probably going to see a whole array of viruses circulating. Many of them we typically see every year. And SARS-CoV-2 will, at least this variant, will be new this year. So I think there is concern that, yes, as people get together and there are close quarters, you can see more circulation. As a group, and this is a broad generalization, but as a group, you know, children have fared better with SARS-CoV-2 than other population groups have. Now, this is not to say that there haven't been several thousand cases around the country. There have been, of course. And that's why I think that all the mitigation measures that we do for people who are not vaccinated and for those who are vaccinated are going to be important. And that will include, you know, distancing to the extent that's possible. It may include some element of testing. It may definitely include masks. All those things should not be, they should be continued.
Now, I've heard a lot of confusion about this term, this phrase called breakthrough cases, and what it really means. It's ranged from vaccinated people can transmit the virus to vaccinated people can get very sick. So can you explain, what does breakthrough cases really mean?
So what breakthrough cases mean is that even in people who are vaccinated, they can still have COVID-19. And so there's a couple of explanations for it. One is that, you know, no vaccine is 100%. And even though these vaccines are highly, highly effective, even a 95% effective vaccine means that some people will have infection despite being vaccinated. And the reason that happens is might have to do with one's underlying immune system, or the vaccine just didn't take for whatever reason. The numbers are expected to be very low for this kind of breakthrough. The other kind of breakthrough infections that we're seeing is the mild infections that are happening in people who are fully vaccinated. And there, I think it's a bit of a misnomer to call it breakthrough, because a vaccine isn't really intended for that particular situation. It's really intended for the hospitalization and complications. So as we see more so-called breakthrough infections, which are these mild infections in people, it's a reflection of there's a lot of circulating virus and the vaccine is doing what it's supposed to, but it can't prevent all the mild infections out there.
There have been at least 500 cases, positive cases, confirmed that came from the Deer District when the celebration of the Milwaukee Bucks was happening. Is this an issue? Are we going to have to go back to preventing crowds from gathering? They were outside, yet they were very much packed together. Lots of events are planned and back on this summer and going into fall. Do we need to rethink those?
You know, I hope that we don't have to, but I think the challenge with some of these events that are outdoors is that they really look like indoor events in the sense that people are very close together. There's not much masking, and people are packed at close quarters. So I still remain much more worried about indoor events than I do about outdoors, but some sort of population de-densifying in the sense that not having people packed together at these outdoor events, I think would be in our best interests. The challenge with Delta, and you have to have interventions that are in response to what we're seeing in front of us. So if you know that this variant is very easily transmissible, then distance between people is one way to prevent that. Masking is another. They're not mutually exclusive.
So are you monitoring the media and how much misinformation is being passed around? And do you think that is having an impact on this more contagious variant being able to take an even stronger hold?
I think there's certainly a lot of misinformation. I think it's also, there's pandemic fatigue. I think people have been doing the best they can for a year and a half, and now to be confronted with a variant like this, it's of course unwelcome news. I think, though, that we do have to stick to what we know, which is that we have this array of highly effective vaccines. And a mild disease, of course, one wants no disease if one can help it, but a mild condition is always preferable to a severe one. And so if the vaccines can help us mitigate that, attenuate the effect, they are worth their weight in gold.
Now, roughly half the state is vaccinated, but the rate of new vaccinations has just plummeted. And health officials at this point are begging people to get vaccinated, providing incentives. So if this rate of vaccination, this level, pretty much stays the same, as well as our ability to enforce public health measures has been considerably stripped, what do you think the picture of this virus is going to look like going forward?
Well, I think if we remain at less than ideal vaccination levels, what's likely going to happen is that the virus will continue to circulate, that it will amplify in those groups who are unvaccinated, and that eventually we will be in a situation where we may have more variants being perpetuated because of this uncontrolled, rampant transmission. So I think that, whatever we can do, this is a whole of everyone response here. We're all accountable for our own protection and that of others. So there isn't anything that's higher priority than getting the vaccinations numbers up as high as we can get them.
What are you bracing yourself for in the future?
I think that we are concerned potentially about other new variants emerging. I think having seen the stuff that Delta can do, for instance, it gives us a better picture of what to expect in the future. I think eventually, though, with even more effective vaccines, or perhaps the booster or some other elements of protection that may come about, I think that what is likely to happen is that SARS-CoV-2 and its various variants will become embedded as part of the usual respiratory viruses that we see. If we can get it to a point where the disease is mild in the vast majority of cases, then it will become into one of those viruses. But we are a far cry from there at this point.
What is the best advice you have for someone who is vaccinated, unvaccinated, anyone in the state of Wisconsin, as we're kind of looking at this new phase of the pandemic?
I think what I would suggest is, vaccination, of course, number one. And then masking, I think just like we were doing in the earlier days of the pandemic, it's not going to be a forever thing, but it needs to be until Delta is under control. So vaccination, masking, encouraging people for physical distancing. And, it's a bit hard to tell people that they shouldn't engage in the activities that give them joy because it's been so long into this pandemic. But to the extent possible, opt for outdoors rather than indoor activities.
All right, we leave it there. Dr. Nasia Safdar, thank you very, very much for joining us.
Thank you.
For more from Here and Now and PBS Wisconsin, you can visit pbswisconsin.org/news. And thank you so much for joining us on Noon Wednesday.